I'm Kathy Fowler for Health Innovation TV, and we're reporting live from Health Datapalooza in Washington, D.C. And joining me today is Cortney Nicolato from Get Real Health. She's a Vice President of Healthcare Strategies. Cortney, how are you today?
I'm doing great. Thanks for having me.
Great. Well, you gave a presentation on the main stage today, and tell me a little bit about what you talked about today.
So we were incredibly excited to have the opportunity to present our application, Instant PHR, which is a patient engagement platform, here at Health Datapalooza on the main stage. We talked a little bit about patient engagement and how the world has changed and what patients are looking for and they need online, from an online tool perspective. And then we gave an overview and introduction to our product and gave a real world example with our client MedStar hospital system in here in Washington, D.C.
So tell me a little bit about, patient engagement's a big buzzword these days, but you guys were sort of ahead of the pack. You were talking patient engagement quite a few years ago.
Right? Yeah. I often say that we've been in patient engagement before it was cool, before it was the buzzword, before it was deemed as the blockbuster drug of the century. We did really see the value in bringing patients into the collaboration, helping them and aiding them in, one, educating patients and understanding their health information, and then two, giving them tools to make change in their health. And so Get Real Health has built 50 plus different applications, both here in the United States and around the world, for many organizations, hospital systems everywhere from the province of Alberta, Canada, building applications for patients in a myriad of different ways. So yeah, we've learned a whole heck of a lot about what patients need and want, and we've brought that back into our product.
So what would you say as far as when you talk about patient engagement? A lot of people, don't understand maybe the ROI, or they think that it's there, but you guys know it's there because you guys have the numbers to prove that it really does not only improve patient outcome, but also reduce healthcare costs, right?
Yeah, absolutely. We've made it a pact of our organization to not only assess the success of the product, but also how it affects the patients and organizations from a return on investment perspective. Now, this could be reducing healthcare costs. This could be improving outcomes. MedStar is a great example of one of the groups that we've assessed in concert with the team at MedStar. So just a little bit of background about MedStar and what we did. ehealth2go.org is their website, their version of Instant PHR. They gave a one-touch glucometer and an introduction to our application by their diabetes educator to the patient. And in a 90-day intervention, they saw average hemoglobin A1Cs go from 9.3 to 7.7. They saw our average blood glucose go from 181 to 153, so significant clinical reductions, all of which have financial benefits for them and for their patients as well. We also see increase in e-health literacy levels, so patients were able to retain the knowledge that they were presented in the application. But then we were concerned about things like access, which is a huge issue within the industry of healthcare overall, and we found that technology restrictions were not there. Patients found a way to get to the information and get to our portal, whether it was going to their daughter's or their son's house, go to the library. They found a way to access it because they found that information to be so powerful for them.
Now, did you find that if you looked at the different education levels or even the different age groups, did it matter? Did it seem to go across the board that everybody found these tools to be effective and easily understandable?
Yeah, in the MedStar case, it was a very low socioeconomic status population, actually pretty high elderly cohort. Again, kind of busting some of the myths that are out there. We've done applications for new moms like myself to manage my kids' immunization records all the way through to, reminding me when it's time for preventative screenings, all the way through to managing, more complex chronic disease patients. And And in the level of kind of retention of utilizing these types of applications do change because the use cases change. A mom like me who needs to pull down an immunization record may not go on as much as someone who's managing their diabetes and looking at their blood glucose measurements every day. And so we have to take that into mind as we're looking at kind of usage rates of these types of applications, is understand the use case in the population who are utilizing them.
And would you say, because you've been doing patient engagement, or you've really specialized in it for so long, is that something that you can bring to the table where you can let people, your clients, know which applications patients will actually use, or how best to build them so people will use them?
Yeah, our philosophy is if our product isn't being utilized, then what's the point? And so it's incredibly important for us to make sure that the products patients are utilizing it, they're utilizing it effectively, they're utilizing it often. So we have a team on staff within my healthcare strategies team. We have clinicians, we have regulatory and policy experts, we have marketing strategy and recruitment experts that come to the table with our implementations and to really kind of work collaboratively to say, how do we get patients into the portal, and then how do we get them utilizing it, substantially and consistently over time in a way that makes it meaningful for them. So, and then we gauge our results, whether it's increased patient satisfaction, whether it's increased e-health literacy levels, the type of studies like what I just mentioned with MedStar are happening in a wide variety of other implementations that we're doing. We'll have a few that we'll be announcing over the next couple of weeks.
So what other clients or case studies could you talk about? I mean, are you doing things with health exchanges or hospital? I mean, you've mentioned MedStar, but other hospitals, United States, abroad?
Yeah, no, we're doing a lot. And so we're working with a myriad of different health systems here in the United States. We're also working with health information exchanges. Many health information exchanges that are out there today have a genuine desire to offer value-added services to their community that are part of the health information exchange. And so they're really looking at patient portals, PHRs, as serving as that value-added service that the health information exchanges can provide, because they have that holistic view of that patient record from that community exchange, and then being able to present it to the patient, but at the same time making that available as a service through the hospital is a great value-added benefit for HIEs. We're also doing a lot of work with community providers, smaller to medium to large size hospitals, depending on their needs. Meaningful use right now is playing a huge role. So we have a lot of hospital systems that are coming to us looking for us to meet those obligations for them, above and beyond just the view, download, transmit, but also with patient-specific education, secured messaging, Blue Button Plus. We have all of those within our arsenal that we make available to those systems. Internationally, we're seeing a huge expansion as well. We are seeing a lot more kind of state, regional, and country-wide initiatives in Europe, in the Nordic region, in the Middle East, and in Asia Pacific as well. And these organizations are looking again to make health information available, but then also make tools and resources available to the patients and the citizens of those countries. And so we have a lot of great things going on internationally. We have a number of deployments already in Canada and in the UK and Germany today.
All right, well, great. Thank you very much, Cortney Nicolato, Vice President of Healthcare Strategies for Get Real Health. And for more information on Get Real Health, you can go to getrealhealth.com. And thanks for joining us.
Thanks very much.